My name is Padraig Lunig and I'm the Deputy Director of Nursing at the Norfolk and Norwich University Hospitals.
My name is Marie McGee and I am the Course Director for the MSc in Adult Nursing.
As an employer, we're very excited about this opportunity, especially on this occasion. It allowed us to engage with our existing staff, to allow them to enhance, develop their skills and to undertake a new career. We're also excited to be able to engage with people with a range of new and different backgrounds and those with the current existing graduate qualifications. And so for us it is about diversity, and of course the ability to complete a nursing qualification within 2 years was seen as a very positive bonus.
The workforce will also benefit from the graduate entry nurses who have the capacity for leadership skills, for really making a difference to patient care experience and being the drivers for service improvement for the future of our healthcare delivery.
Again, a wonderful opportunity. We found that people who've undertaken the pre-reg experience have actually got to know our teams, got to know the ethos of our organisation, and have really started to integrate and become members of the team.
The pre-nursing experience is really important for that direct support from mentors in practice, because part of the requirements of the MSc programme is to provide a portfolio of evidence of practice experience and care skills, and the support from the mentors will be invaluable in order to get that portfolio.
The sponsorship really allows us to start that relationship very early on in the learning process. It signals to the students that actually we support you, we want you to be part of our future team, and it's a commitment that we make to them very early on in their programme.
The benefits of the sponsorship initiative is really important for students in terms of the financial support. It is one of the biggest worries of students when they come onto an MSc Adult Nursing programme, because they've given up a lot to come onto it. And the students will get through this initiative an extra £3,000 a year.
The employment agreement is a key part of our relationship. Again, it signals to students we're interested in you, we're committed to you, we've got a job for you in the future. So it really sets people out at the start of the programme to understand that as an organisation we're behind them, we want to see them succeed, and we're committed to their future career with us.
The benefit to employment is that the students will be guaranteed a job for up to 3 years after they graduate. That's really important for students, especially graduate entry, who have given up an awful lot to come in to nursing as a graduate entry, and they can be secure that they've got a job at the end of it.
For my first degree, I studied biomedicine, and I did a second degree in biomedical research as a master's.
I studied marketing, media and cultural studies at Canterbury Christ Church University.
After my degrees, I worked at the Norfolk and Norwich University Hospital. I worked in pathology for a couple of years, and then I started to work full-time as a healthcare assistant.
I left my degree and went back to work in McDonald's for a period of time, and eventually I worked in accident and emergency, where I realised that I actually really wanted to be a nurse, and so ended up engaging in the pre-nursing experience and becoming a healthcare assistant, and now joining the MSc Adult Nursing.
I was really interested in the medical side from my degrees, and then working as a healthcare assistant, I really enjoyed my job and I wanted to progress, be a bit more hands-on, learn some new skills.
I never wanted to be a nurse until I actually started working in the healthcare service. And then I realised that I actually really wanted to be part of a team that cared for people and provided care. So
I think that from my prior learning experience, I've learned time management to enhance my communication skills, and working as part of a team I found has really helped me through my studying.
it is really interesting that the nature of my previous degree was quite sociological. So bringing a lot of the sociology aspects from that forwards into this new learning environment, as well as just the general learning skills that I gained from my first degree. And working in accident and emergency, I've got basic knowledge of triage and all sorts of things that I've picked up over the years. So I worked in the Norfolk and Norwich Hospital, and I was brought from accident and emergency as a receptionist into working as a healthcare assistant on the renal and endocrine unit. And I worked there for 5 months and worked on my portfolio for the first year.
In terms of the sponsorship offer, it's really helped me because I won't have to work as much during my degree, meaning that I can focus a lot more time on my studying.
It actually made a really big difference to me. It's really helped in the sense that otherwise I wouldn't have any money particularly, and it's very difficult to kind of focus on work when you have other concerns, and so having that extra little bit of help just really helps alleviate those worries.
When I qualify as a nurse, I would really like to work in A&E at the Norfolk and Norwich.
Definitely in Norfolk for now. I'd love to work in the Norfolk and Norwich. I think it's a great hospital. I'd quite like to work in accident and emergency, but I would like to get a bit more of a breadth of experience before I go in there.